Hello everyone, it's Dr. Cary Yurkiw here and welcome to today's webinar. I just came back from my morning workout, my run, so I'm still in my running gear, but I really want to talk about arthritis this morning because on the weekend I saw quite a few people that had arthritic conditions and I wanted to talk about what causes arthritis and how we can help. So today we're talking about arthritis and what causes it. So if you're on Instagram, you'll just have to kind of follow along and listen to me. If you're on YouTube, then you're going to see these slides as we progress through this. And at the end, I'll read a little bit from my book called Back Pain, and I'll read from the arthritis chapter. So what causes arthritis? Well, number one is injury. So injury can cause arthritic conditions because when you have an injury to a joint, it damages the joint. Inflammation is present, and that inflammation starts to the repair process of healing the joint. But while there's inflammation there and some breakdown, that's an arthritic condition. And the definition of the word arthritis comes from a Greek word meaning arthro, which is a joint, and then itis is a swelling of a structure. So arthritis is swelling of a joint. A poor alignment can also cause arthritis. And we see this in the clinic where people come into the clinic, they're off balance for one reason or another. Maybe their alignment is poor, they've had some poor posture over time, or there's been some injury and they're compensating. But basically, there's poor alignment, and that's going to cause a wear and tear where one side of the joint is going to get more use than the other side of the joint. So we see breakdown of the joint structure. And here we're looking at the knees, but we can start to see narrowing of the joint in arthritic conditions where there's some sclerosis or whitening of the bone surface as the cartilage and the bone gets overused and broken down. And then systemic conditions can cause arthritis too. Systemic conditions are conditions like rheumatoid arthritis, where we get people who have an inflammatory condition in many joints and sometimes there's some hereditary factors involved in some arthritic conditions. So for those conditions, we want to manage that condition, improve the alignment and the function of the joints, and make sure that person lives as healthy of a life as they can. So we're going to talk now about how it can be helped. And I have a picture here of a car, and this guy's putting this tire on and doing the alignment of the car. And that's a good analogy for what we do in the clinic. We look at the overall structure and the overall alignment of the body, and we want to make sure there's good balance, because if there's good balance, then the joints will wear evenly. The other thing is the function of the joint. The joint really needs good function, good flexibility, because if it doesn't have very good flexibility, the synovial fluid and the nutrition flow in the joint is poor, and that can lead to poor restoration of the joint. So if there is some injury, we need to have those tissues being healed, scar tissue being formed, and the collagen matrix changing over time, and we need that flexibility. So I would say long term, not only is alignment important, but flexibility of the joint is really key to joint health. And then nutrition. Joints need the proper nutrition, and we know about calcium and vitamin D and how important that is to bone. But for the joints, you need collagen and you need protein to rebuild the joint structure. So you want to get the highest quality nutrition, and you want to make sure that your body has the building blocks to heal properly. And then finally, lifestyle, stress levels, sleep, exercise, they're all very important in rehabilitating the joint and keeping the person strong and healthy. So as we work on the patient's joints to restore the alignment and the function, we want to also give the patient advice on nutrition and lifestyle, things they could do at home to help themselves. So I'm going to read a little bit about arthritis from my book called Back Pain on Amazon. And I'm just going to switch over to that slide here and So I'm going to read from my book called Back Pain. This is the manuscript, 25 Years of Helping Patients with Chronic Back Pain and Arthritis. And I'm just going to go over to the chapter on arthritis. So I'm going to type that in here, and we're going to skip over to that chapter on arthritis because that's our topic today. And here it is, chapter 5, and that is arthritis. So arthritis. Arthritis is something that I see in the clinic every day. The word arthritis comes from arthron, meaning joint, and itis, which is a disease. Inflammation is a common reaction to the body being injured and needing repair. If joints are out of place and inflamed, they are prime candidates to break down and become arthritic over time. There are different types of arthritis, namely osteoarthritis, rheumatoid arthritis, and psoriatic arthritis among the most common types. If the joints in the spine are breaking down, that is called osteoarthritis. Some patients think that osteoarthritis is part of the normal aging process. That would mean that everyone who's 40, 50, or 60 would have a spine that looked the same on the x-rays. But that's not true. I see a wide variety of spinal conditions in people of all ages. I've seen 30-year-old spines that look twice their age. Age does play a part in the healing process, as it takes longer to heal the older the patient is. There's more chance of injury the longer you live, and with the slowing of the repair process, it will make it more difficult to recover. But all hope is not lost, and the patient does not have to learn how to live with their condition and accept that they're getting old because they have arthritis. Yet many patients have been told that they have arthritis and they must learn how to live with their condition, and that they must, and it's part of the normal aging process, but that's not true. A good analogy for the arthritic process is the alignment of a car. If the car is out of alignment, then the tires and the wheel joints will wear out unevenly. One side of the car will wear out much faster than the other. The joints may begin to squeak and rub, and the tires will wear bald on one side faster than the other. This happened to me years ago when I took my car in for an oil change. After the oil change was complete, the mechanic asked me to come over because he had something to show me. He showed me the wear and tear on the tires on the right compared to the left, and said there must be an alignment issue with the car because the tread was far less on one side compared to the other. That's a little bit from my book on back pain. You can get that on Amazon, and it's in 3 formats. There's the audiobook, there's the ebook, and there's the paperback as well. So if you're interested, you can go over there. The other thing I want to tell you guys about today is people in the Kelowna, Okanagan area. We are accepting new patients. So you can just scan this QR code right here in the top corner with your phone, turn on your camera and hover over that, and that'll take you over to a link where you can book an appointment or order the book. You could also just click on this link or type it in, Linktree with the dot in there, / Dr. Cary Yurkiw, and you'll be able to get to our main menu where we have all of our services available there. And then on social media, we're at Dr. Cary Yurkiw. So that's our handle on Instagram, on Facebook, and Twitter. You could subscribe to this YouTube channel, and then you'll get updates on when new videos are ready. And then we often take the audio part of the videos we do, like this one, and we upload it to our podcast called Super Healthy. That's on Android and Apple. So if you're interested in getting our podcasts and getting updated, subscribe to your podcast provider, and then you'll get automatic updates if you follow our channel. So I want to thank you for joining us today. Hope you learned something about arthritis, and I look forward to talking to you guys soon. Please follow us on social media and YouTube and our podcast. And then if you're in the Kelowna area, feel free to click on the link to book an appointment, and we'll see you soon.